This isn't just another headline, it's the living nightmare of Tanya Walker's family. Back in November of 2023, the 51-year-old Sacramento mom vanished. Her sisters searched everywhere, drains, ditches, train tracks, until July 31st, 2024, when they got the unthinkable call. A deputy said a body was found in a morgue. Imagine entering that cold warehouse, hoping for closure, and then seeing your sister's lifeless form, missing eyes, stripped skin, looked as if she never mattered. They say that Dignity Health assumed homeless patients had no families. That callous mindset left Tanya's body unclaimed, unlabeled, and eventually harvested for organs without consent. But Tanya is not the only one. At Mercy San Juan, Tony Peterson's mother, Jessie, died after a diabetic emergency and was pronounced discharged. Over a year later, she was discovered in a warehouse morgue, her remains too decayed for funeral viewing or even an autopsy. The California Department of Public Health audits in 2022 and 23 flagged the hospitals for tragic repeated failures, missing death certificates, delayed family notification, botched morgue protocols, yet regulators deemed the chain compliant. These families aren't just angry, they're shattered. They've endured months of agonizing searches, falling prey to scammers before the truth surfaced. Their loved ones were in institutional limbo. Now they're suing for gross negligence and intentional emotional trauma. One suit has already settled, others are moving forward, but no criminal charges exist. So what's emerged looks like a systemic bias. Vulnerable patients, homeless, transient, were treated as disposable. Bodies stored in warehouses like lost items. Families left in limbo. Hospitals hiding behind assumptions instead of accountability. And Dignity Health? They insist it was an unfortunate misunderstanding. But audits paint a different picture, one of ongoing procedural breakdowns, failed dignity, and human lives reduced to baggage. So this story forces us to ask, can a healthcare system still call itself caring when it loses the body of a loved one, when it blames poverty instead of fixing protocols? It's more than negligence. This is a breach of humanity. So for Tanya, Jessie, and others, a name on a shelf should have meant compassion, respect, and truth. Instead, it became another tragedy hidden behind hospital walls. The lawsuits press on, families demand transparency, and the public must hold these institutions to account, because no one should suffer this type of neglect or die without dignity.